So in order to take care of the TFL and the glute and address any kind of bursa or IT band and lateral quad issues, generally your two tools are going to be your softball and a lacrosse ball. For the TFL, generally the softball will be a little bit too large. It'll just kind of end up rolling over the TFL. So we'll typically want to use a lacrosse ball to actually get into that tissue and really create a meaningful change. So remember that tissue starts up kind of right along the front of my pocket. So I'm going to put the ball there. I'm going to come down onto the ground. I'm going to be a little bit on an angle, sort of like a 30-degree angle off the ground. I'm going to find that spot. And when I have that spot in the TFL that's a bit uncomfortable, I can kind of windshield wipe my legs back and forth, or I can cross friction over it side to side. So now by cross friction, what I mean is those tissue fibers go this way. So I want to cross friction it perpendicular to that tissue path. So that's for TFL. For the glute, you can use the softball. Generally, it's a bigger muscle, so the softball is okay. Where a lot of people actually miss, if you see where my hand is, that's where my hip bone comes up to. Your glute is anything below that. A lot of people will miss that high lateral glute, sits in a little bit of a fossa, and the lacrosse ball is the better choice to get in there just because it can dig in a little bit deeper into that tissue. Whereas the softball, much like with the TFL, will just kind of roll over it without truly getting into it. So in order to do the glute, I'm going to take the softball, get down onto my hip, cross my leg to open the hip up a little bit, and I'm going to work around till I find a spot that's uncomfortable in the glute, and I'm moving it up and down. I can go back and forth like a windshield wiper like I did with the TFL as well. Now if I wanted to get into that higher lateral area, taking the lacrosse ball, I can lay down onto it so it's just below my hip. So my hip comes up to here, and the lacrosse ball is just below that, and I can roll side to side, cross friction like I was doing with the TFL, or I can pin it and bring my leg up and down, and same thing I was doing with the glute there as well too. So don't be afraid to roll up and around that PSIS, or that little spot that most people will point to when they're having back pain, or say, hey, it kind of comes into some people describe that as their SI joint. Don't be afraid to roll up and around and explore that entire area of tissue that is all glute. Some is medius, some is maximus. The more to the side you get a little bit more of the minimus. But these two tools are going to be your ideal ones to use to address these two issues. Now if you're having some bursitis or more of that lateral leg kind of greater trochanter pain, the IT band can be a culprit there. The IT band sometimes will kind of get stuck on that lateral quad, and then they don't glide like they're supposed to. Increases tension across that bursa and can irritate it. So you can take the ball onto the side of the leg, kind of up and down here. So if I'm in this position, so you can see, I'm going to come to that position there, and then I can move my leg back and forth, bending and straightening my knee. I can cross friction side to side. If that's too difficult, you can go onto your front. So I was going to do my other side, and I can kind of come up this way. Sometimes that's a little bit more manageable from an upper body standpoint in terms of supporting your body weight. If the softball is too intense, which for some of you who are currently in pain, or some of you guys have never done myofascial work, it may just be too intense and too painful, then I'd recommend grabbing a foam roller. It's a bit of a broader surface. Utilize that as an interventional tool in the beginning, and then as it gets a little bit better, it's not hurting as much, then go to the balls where you can be a little bit more aggressive and a little bit more pinpointed. So hopefully this helps in terms of clearing up some simple interventions that you can give a try for a couple of weeks to alleviate your discomfort on your own, and also to maintain the quality of your hip motion while you're trying to prevent anything from happening, such as your hips getting tighter and you not being able to rotate. These are great recovery tools if you're going on a golf trip, playing professionally, playing competitively, or just playing on the weekend. These should be the first thing you hit when you get back to your room, or when you get back home or to the gym as a recovery piece, in order to assure that you've maintained your mobility, recovered well, so the chance of you getting hurt is a lot less.